Okay, so we're going to switch gears a little bit here, partly because I am not really an aging researcher, although by osmosis I seem to be becoming one. And as my sample ages, I'll certainly be becoming more of one. But I want to talk to you today partly about the high school and beyond longitudinal study. I was struck this morning when people were talking about longitudinal studies for aging. Of course, WLS is, right. But high school and beyond doesn't really come up, and part of my job is to make it start coming up more. So I want to tell you about this study and encourage folks to track us and to use the data as they come out. So a little bit of background for you on the study. High school and beyond is a population sample of folks who were sophomores or seniors in high school in 1980. So they would have been born between 1961 and 1964 for the most part. There are a little over 1,000 schools that were sampled and participated in the study, so it's a clustered sample at the school level. And it has over samples of Cuban-serving public and Catholic schools, other Hispanic schools, Black Catholic schools, and other non-Catholic private schools. The base year sample is, as I said, nationally representative of that population. Actually, the base year sample is really big. Over 53,000 students participated in that. The panel study is a smaller stratified sample of that base year, selected in 1982. And at that time, about 12,000 seniors were included in the panel study, and about 14,830 sophomores. The sophomore sample in particular has high school transcripts, and you'll see some results based on those transcripts shortly that have proven to be fairly powerful in understanding certain dimensions of health and mortality, even at midlife. And then as the panel aged at this juncture between high school and college, once again there was an oversample of African American and Hispanic students who were higher achieving based on base year test scores. And they tried to retain, I think, all the dropouts in the sophomore sample. So it's a stratified sample that really tries very hard to get both at the more advantaged and less advantaged ends of the distribution after high school. One of the things that makes this study, I think, very promising for our understanding of cognitive aging and resilience as people age is that we have base year test scores in a variety of domains for sample members. So all of the students, sophomore or senior in the sample, took a math assessment, a standardized assessment in high school, and a vocabulary and reading comprehension assessment in high school. For sophomores, we actually have two observations for those studies. Their sophomore and senior year. For seniors, we have the one. But in addition to that, sophomores took a separate set of assessments in science, writing, and civics. And then seniors took a picture number assessment that looks very much like the paired recall assessment some of you would be more familiar with in research on cognitive aging. Mosaic comparisons that look kind of like Raven's matrices for understanding pattern recognition and perceptual speed. And then visualization in 3 dimensions. So there are all these different components of cognitive processes that high school and beyond measure, not intending for it to be a study of aging, intending for it to be a foundational study in understanding cognition and labor market success, educational success, really through young adulthood. And so these cohorts were followed up in 1982, 84, and 86. Both cohorts were followed up. And then at that point, the U.S. Department of Education stopped following the senior cohort. They went back to the sophomore cohort one more time in 1992, and at that time did a really terrific job of collecting all the post-secondary transcripts for folks who had been to college. We have post-secondary transcripts for seniors too. That period of observation is more limited because they didn't go back in 92, but probably for about 3/4 of them we would have their college transcripts. And then nothing happened for a long time until a couple of sociologists walk into a bar. And one says to another sociologist, "Hey, what would you think about following up high school and beyond?" And this other sociologist, perhaps a few beers in, says, "That sounds like a great idea." I wasn't one of them, but they called me. So that was Chandra and Rob. So we hatched this plot to try to go back in the field and collect additional data from high school and beyond. And so that led to this midlife follow-up. So we first collected data from the sophomore cohort, then the senior cohort in short order. And the focus at that midlife follow-up was on patterns of work, on health. We got some non-cognitive skill stuff like conscientiousness. We're also interested in understanding civic participation, so voting's in there. Economic security, financial status and wealth. Also, for me, I think especially interesting, education, because it turns out that a very large share of people continue their education past their mid-20s. When I tell academic audiences about this, for some reason at first they're surprised, and then I wonder to them, when did you earn your PhD? Was it 25, 26? And most of us, it's a little later, right? So this may be not entirely surprising if you think about it, but the magnitude of it sort of surprised us. So I will just give you a few cameos of some of the findings from the initial follow-ups that we've done, the 2014 and 2015. So one, we're Wisconsin, measurement, right? So one question is, does it matter how you measure mortality? Does it matter for estimates of mortality for these panel studies? Does it matter for predictors of mortality? Is it the case that you get a different story about the relationship between, say, cognitive skills in high school and incidence of mortality if you use one measure versus another? We were fortunate to have multiple measures of mortality with the sophomore cohort. We went to Accurate, which is a company that tracks people and has mortality records in it. Social Security Death Master File, you'll probably be familiar with, of course, the National Death Index. And then there's this other line here, NORC's final disposition. We worked with NORC to do the data collection, and they actually did a pretty good job of trying to track folks down. And so when they would have a next of kin who would say, I'm sorry, that person is no longer living, or if they found an obituary in a newspaper, they did all sorts of searching. And so you could sort of think of this as like our perhaps our best guess at who had died at the time of data collection. And then any of the above and all of the above. And what you see here is that you do get different estimates of mortality rates depending on the source of data you use. The source of data matters. So one might be concerned about this. One perhaps should be concerned about this. On the other hand, we don't see much evidence that conditional associations between background attributes and mortality vary depending on the measure you use. Now, keep in mind, this is mortality by midlife, so happily the mortality rates, maybe 9%, 10% of these folks had died. So it may be that as people age, differences in these sources matter more, but at midlife we don't think that the differences in sources matter much in terms of understanding processes from education to mortality. So one might also wonder what the role of education is. We wonder this a lot because the two sociologists in the bar and the one on the phone are all sociologists of education, although Rob does a lot of other stuff too. Chandra and I are squarely sociologists of education, so we're sort of obsessing about how does education matter. We know there are educational gradients in reports of morbidity. We know there are educational gradients in mortality. Hauser and Kitagawa on up. So the question is why? Right? What is under education that might be driving this? And high school and beyond gives us a good opportunity to really push on that. And so one of the things that we found is, so here's mortality at midlife, and this is with a bunch of other controls for background, economic, parents' education, early health things that we had in high school and beyond, like BMI, from their sophomore or senior year. So what is it about education? First, we can see there is, in fact, this sort of education gradient in the risk of mortality at midlife. Risks decline with higher levels of education. But interestingly, coursework seems to be associated with mortality at midlife, mathematics coursework in particular, net of all these other controls. So it looks like Algebra 2 at least seems to be, Algebra 2 or higher, seems to be associated with lower prevalence of mortality at midlife, net of a host of controls, possibly Algebra 1 as well. And so that has led to a lot of discussions amongst us. Some of us perhaps think this is more causal. Some of us perhaps think it is more endogenous. But certainly something that's worth thinking about and paying attention to as we move this work forward. We've also looked at self-rated health at midlife. And again, questions about what are the roles of educational experiences in high schools, test scores, grades. Locus of control is one of the few non-cognitive skills we have a measure of from the sophomore year on, 3 times, I think, over the course of that study. And then, do these early advantages or disadvantages operate on subjective health through the probability of attaining higher education, or do they actually have some independent association? And the answer seems to be that they do have some independent association. So in this scenario, we took bundles of courses. So instead of focusing only on math, think about whether you have a mix of low-level courses, medium-level courses, or high-level courses. And the mix could be like you have some low-level English and some regular-level science, or whatever it is. So you can think of this sort of like track. And so the story here is that, in fact, courses do seem to matter. They matter in a model where you have background controls for race, gender, adolescent health. They matter in a model where you, and what do you add? Trajectories. So we also looked in this model on whether grades change between the sophomore and senior year, whether test scores change between the sophomore and senior year. And then finally, we add measures of their post-secondary education through 1992. So did you attend a baccalaureate college, complete baccalaureate college, et cetera. And what's sort of striking is that this high-level course thing persists in its association, even net of going on to higher education or attaining a higher credential. Likewise, grades continue to be associated with subjective health, as does locus of control, and test scores in a really rather counterintuitive way. It's recoded, so 5 is excellent in this case, for those of you who use this measure a lot, so higher would be better as opposed to worse. So again, there seems to be something going on with academic background, with course taking, and perhaps with grades and test scores. And so that's sort of a sampling of some of the early work coming out of the midlife study, the midlife follow-up. But wait, there's more. So we went back this time to the National Institute on Aging, and on our second attempt, I think, said, hey, no, really, wouldn't it be great if we collected more data to try to understand mild cognitive impairment as these folks enter midlife and as they age further? And NIA said, sure, we'll give you some money to do that, so that's what we're doing. The focus is on mild cognitive impairment. There will be a cognitive assessment as part of the study. This will go into the field most likely January of 2021. We're working on all the design elements now, but there will be a cognitive assessment. We are budgeted to collect saliva, so we can do some genotyping with the saliva from an Origene kit. We are working very hard on finding a way to fund a whole blood collection for the sample, and we've also been recently discussing the possibility of a microbiome collection. Whether it's oral or gut remains to be seen and is a subject of continued discussion. And then survey measures of things like work, social support. We'll go back and get more information on their educational attainment. And then, and I think this is consistent with a lot of what we've been talking about, the opportunities to link to administrative data are really remarkable. And we're trying to capitalize on those opportunities to increase the scope of the sorts of questions that we and other researchers can ask using these data about aging processes. And so we're working on a pilot to link high school and beyond sample members to the Central Cancer Registry, to the tumor registry, to understand incidence of cancer. We'll of course work to link to the National Death Index to continue tracking mortality. We're also linking to data on property transactions and property values to understand something about wealth. Many of you have followed Fabian Pfeffer's work on this and the claim that a lot of the variance in wealth can be captured by the value of one's house property. So we're working on that, and then voting as well, thinking about how people participated in voting over the life course. So as I said, we're funded to do this follow-up now with NIA. We're going to go out in the field in 2021. It's going to be a mixed mode study. We're leading with the preferred mode. So whatever historically respondents have been most likely to respond to, we're going to lead with that mode, whether it's phone or web-based. And then we're going to try to move a subset of web respondents to the phone to try to get more precise measures of cognitive function. and then have a brief paper non-response. But again, this is largely going to be focused on mild cognitive impairment, on cognitive function. And if we can get the biomarker funding, we'll certainly collect those as well. I think most of you actually are here, so please, if you have ideas about particularly the microbiome and the blood marker stuff, any of the biological stuff, I'd love to hear from you. We're still talking this through. And if you have ideas and you're not here, it's easy to find me. So thank you, and thank you to our bevy of funders for supporting this work. Jim.
So obviously the high school class stuff and its link to later morbidity and mortality, that's interesting. And I'm sure you've thought about this a lot. Sort of obvious explanations for that might be correlation with unmeasured indicators of background advantage. Others might be the association with subsequent economic and occupational trajectories that you don't measure well. You may or may not be confident that you're taking care of all those things. But another thing related to something I mentioned earlier that may plausibly be relevant, and I wonder if you guys have thought about it, is more about the processes that lead students to actually take these courses in the first place. Conscientiousness, ambition, focus, the kinds of things that Bob and others have talked about being linked to a high school rank or something like that. Not intelligence or not test scoring or things like that, but the underlying processes that would lead you to be in those classes in the first place. And is that part of the story, or? I know you don't know the answer to that.
But depends who you ask.
Yeah.
If you ask me, I think it most likely is, and we don't have great measures of it. One of the reasons we put conscientiousness in the last follow-up was to try to get some handle on that, but of course that's much later, right?
Yeah.
And so there is a correlation maybe on the order of 0.25-ish in other studies with conscientiousness from late adolescence on. That's not great. So could there be other things going on? Yes. How we get a handle on those is really sort of unclear. Now, in terms of the economic trajectories, so plausible mediators, I think we can do better on those, particularly if we can do something like link to LEHD or link to Social Security earnings, which is still on my aspiration list, one step at a time, but hopefully we'll get there. So I think you're right. There, in my view, are likely omitted variables that lead students to these courses. Now, one other thing I'll say is we do have measures of whether a high school offered advanced math, and so we can at least condition on the opportunity to do that, and that hasn't actually accounted for a lot of the action. Dr. Carlson.
I'm just curious, obviously you and Rob and others are very connected to the place where the WLS started, so I'm wondering if you're intentionally going to develop some measures to do comparisons with the WLS.
So that's a great question. I was actually thinking about this morning, and Debbie and I were both at a meeting that Michigan organized in DC. So I don't know how consciously we're modeling on WLS per se. I know we've taken some stuff from HRS. I think it would be extraordinarily helpful if all of these studies, NLSY included, sort of thought more intentionally about replicating particularly things like cognitive items across studies. I think that would be terrific. I don't know how good a job we've done at that so far, at least high school and beyond. Rob, yeah, go ahead.
Part of the issue is that the 2011 cognitive WLS tests were in person, and we're by phone and web, and so you've got to adapt the test to the mode, which makes it hard. Even there are some similar tests, but in an in-person setting, it's a little different.
Yeah. And that's also part of why we're sort of experimenting with the web screener, right? Because I think we probably have more confidence about the phone than the web, and maybe even more confidence about in-person than phone. But I think the point still is a good one about the utility of organizing across studies. John.
This is a very small question, but I'm curious about this web-phone comparison, because it seems like with web you'd be able to measure timing in a very precise way.
Well, maybe. It depends on connectivity. It depends on whether you're doing it on your phone or on your computer. And that's stuff we've spent a lot of time worrying about already. And then the flip side of that is actually on phone with the caddy operator entering what you say, you have pretty good temporal dimensions there too. So I think that's stuff that we'll collect. Yeah, and this came up recently in a conversation with Jen, right, about the latent timing issue. Jen Manley is a co-PI on this, and she is a neuroscientist at Columbia, because somebody has to know what they're doing. It's not us. And so but she was making this point that if we can collect the timing data, it would be very helpful, and there's work on that. Yeah. Okay, thank you.